people.
Absolutely.
Yeah, fantastic. What's the time? It's 6 o'clock. Do you want to just crack on, or do you want to give it a minute or two?
We can give some people time. Yeah, we can give them time.
Yeah. Oh, I think there's a question box at the bottom. So if you hadn't sent your questions in on the question boxes or directly to our inboxes, then you can put them either in the chat, if you're okay with that, or you can put it in the messages down below as well. Hopefully this is the first man in the world to be able to multitask.
Okay.
So we'll see.
Just organizing my screen.
Yeah. Yeah, so I think we'll get started. We only have about 40 minutes, and 40 minutes like really just flies by. So we'll try and cover as much as we can, and whatever we can't cover, we'll answer individually, or do another live if people want it, really.
Oh.
Yeah. So can you hear me, Harriet? Oh, you're frozen a little bit. All right, excellent. So I guess we'll just start. Probably we can start just with the introduction. So of course, ladies first, as always. So maybe just tell us who you are, what you do, what your journey has been to where you are now.
So my name is Harriet Chebet-Ngok, and I am the CEO founder of Harriet's Botanicals, a company that retails traditional indigenous medicine for the urban African and diaspora market. We are almost 6 years old now in the market, officially that is. So we have up to 16 outlets, including distributors. We also sell in Healthy You. We are in 31 Healthy You branches.
Nice.
And so I think for purposes of this live, really, we're talking about a product, Harriet's Botanicals Arrowroot, which is for reproductive and digestive health for women.
Yeah, fantastic. And that's, as I told you, half my patients on Arrowroot. So I said, I have to speak to the person who runs this company, because how can I advise on something that I don't have enough information on? When we spoke earlier, we were speaking about, you find people on 2 different treatment modalities. So you have like the allopathic medicine is what like I do, and then you have the botanical bit of it, or the herbal medication. And a lot of the time you find people on these 2 hills. They don't see eye to eye a lot of the time. And I thought like doing this kind of live would be able to like bridge the gap between the 2 of us, because I have lots and lots of good feedback about your products. And like where there's smoke, there's fire. There's something that must be working for all these people to be giving such good feedback. So do you want me to just dive into some of the questions?
Yes, we can just go with the flow. I know we talked about this, okay. I know about this big, especially in Africa, because you see, every culture in the world has their traditional medicine. It's just called something different. There's the European apothecaries, which actually over hundreds and hundreds of years, initially actually European apothecaries were run by women. And then it's safe now with the advent of the pharmaceuticals and the industry, those became the pharmaceuticals, predominantly now run by men. Then we have in India, we have the Ayurvedic tradition. We have Chinese medicine everybody knows about. So I think it's only African medicine that is getting quite a bad rap. And I think it's just remnants of colonialism. So plant medicine, plant medicine is plant medicine everywhere. Majority of what's the bioactive components in the medicines that allopathic practitioners use or prescribe is actually made of plants. So this is really plants in the raw form, plant medicine in its raw form, unprocessed or minimal processing.
Yeah. So maybe I'll just start off. We have lots of questions on. Let's maybe focus on Arrowroot, because that's like my field, reproductive health. What is Arrowroot? What does it contain? How did you come about it? So that my patients ask me, what I know I'm taking this, but doc, I don't know what's in it, and how will it help me? So what is arrowroot? What does it have?
So arrowroot is made up of 8 what we call trees or bark or roots. Out of the 8, only 2 are trees, and one of them is the arrowroot tree, which is actually Cape Ash. And now, so we have a patented formula. So our formula is protected, but some are roots, some are bark, some are like the stem. And the whole idea is it's a synergistic combination that is supposed to improve your hormonal profile and improve hormonal health and actually bring you to fertility. So in my culture with the Kipsigis means to sigis. Sigis means give birth. So when women got their periods, like let's say 14 or 15, and those of them who say, oh, it's painful, they would be given some of these herbs, you know, just to sort of like smooth over the transition, at puberty. So the same herbs are used across the life cycle of the woman. So they're used at puberty, minimally and with supervision. They're used when women are fertile, and then they're also used perimenopause and menopause. Different combinations, different bioactive components, and emphasis of some or more or less. So now, what I can say about arrowroot itself. So arrowroot itself is actually for digestion, because it helps with just, detoxing you and, let's say, flushing your stomach off all the bloating. So whenever you find women who have issues with their reproductive health, there's always also an issue of the digestive health. So in, cultural traditional medicine, the digestive and the reproductive go together. So it's like wanasema unaosha tumbo, you clean, your stomach. But what they really mean is the digestive system, the gut, and the womb. So when all those are working together, then, it's unlikely you will have period pain. It's unlikely that fibroids are growing or ovarian cysts. It is unlikely you have polycystic ovaries. So a number of things are happening, when you use this product. First and foremost, something is happening in your liver. You're metabolizing excess estrogen. And then it is passing on the estrogen. It has to now go into the gut. And literally, if you're not having regular gut bowel movements, then you are reabsorbing estrogen. And at that point now, you are estrogen dominant, and your estrogen is higher than your progesterone. So when we talk about the liver is being affected. We talk about the digestive system being affected. I've talked about digestion just now. And then also the kidney, it's a diuretic. So the different trees and roots and barks in that formula have different functions. You can have one that is very well known, Carissa edulis, and we call it legetetiet, and it's one of the 8. And that one is actually a natural painkiller and a decongestant. So when your womb is congested, so to speak, and I'm sure there's the scientific term that you will educate, that now helps to sort of like soften and make everything like soft. If you have PID and you have a lot of mucus like adhesions, either in your fallopian tubes or, coming up the urinary tract when you've had a UTI, which became a PID or persistent UTI, when you have all this inflammation and scarring. So the idea is to soften the scars and open up the womb, open up the tubes. Then you have, I've talked about the arrowroot itself, what you do. Then you have another one that stimulates fertility. And you find a lot of women who have fertility issues also have very low libido. So because we are regulating the cycle, we are bringing it to 24 to 28 days. At the same time, we're stimulating fertility. Libido also goes up. Ovulation, we want to see like ovulation. We want to see the clear mucus. So all those things that, when you're ovulating and you're feeling so amazing, you're feeling so sexy, now you're at your peak fertility. And I'm sure you can explain that in more scientific terms. So I'm just sort of like a broad brush over what the product is doing.
Yeah, I'm glad you mentioned like from the scientific point of view. So the first question is, how good are these herbs in handling fertility issues like PCOS? And are there any side effects? So when we speak about PCOS, we know it's a disorder of hormone production. So it's a hormonal problem. The most common cause of lack of ovulation is PCOS.
Yeah.
For us in PCOS, we know the hormones produced by your ovaries, by your pituitary gland, LH, FSH, are out of sync. We know your estrogen levels are high. We know your testosterone levels, the male hormone, is high. And that's why you'll get acne, you'll get male pattern hair, and that kind of thing. So when we're treating it, we're giving you medication to reduce your male hormone levels. We're giving you medication to balance your hormones. And for us, like from allopathic point of view, then we have had decades and decades of studies on any medication that we're giving, for example. So that begs the question of, okay, it's one thing to say that it can cure, it's almost like a cure-all for reproductive health. So it can cure fibroids, can cure PCOS, can cure PID, can cure infertility. But what studies have been done to back up those claims? I mean, of course, I'm seeing the feedback. I can't ignore that. But if I'm to, like with a clear conscience, prescribe Arorwet, for example, how do I know how it works? How do I know what it's going to do for my patient?
So first of all, we don't even say cure. We don't use the word cure. If you look at all our bottles, we will use the word alleviates, right? So I want to just emphasize that when I first started using I was only using the product for pain. And when it was given to me, it was because I had heavy periods. And on the day that the people noticed what was going on with me, I had been bleeding for many, many days, clots and all the attendant effects of overbleeding. At the same time, my periods used to be really bad. I used to take both over-the-counter and prescribed medication, including your Betapin, etc.
Yeah.
So for me, I just took this thing for pain. And literally, I tried it. I was amused at the idea that there could be something like this.
Yeah.
So I tried it. And when it worked for me, I went back for more. And I gave my friend who was on her way to a hysterectomy. And because she had also been bleeding for 3 weeks, and she was bleeding like, it looked a bit like porridge, lumpy porridge. And they had scheduled a hysterectomy for her. So I told her, before you go, as you're going for your hysterectomy, try this to help you. And sort of like, she came back and gave some good feedback. Then I still wasn't really selling it. It was just that now word got around that, I have this thing that can help women who have heavy periods or painful periods. So when I first started giving it to friends and family and selling it a little bit here and there, and that was kind of like maybe 2 years before the 5 years I speak about, it was other people who started telling me what else it is doing. It's other people who came back and said, well, I had this, it helped me with this. I had this, it helped me with this. And when I tell the story of how we went from making 10 bottles in a souffrier in the kitchen to making 100 bottles, 10 bottles on 10 GCOs, to how now we can make 1,000 bottles a day. It is really driven by demand. And it is people who then come and say, I have PCOS, I used it for this, I did this, I'm pregnant. I did this, I'm pregnant. Then I started saying, oh, it treats fertility. Is it primary infertility? We had a lot of women who had used the P2 come to us at the beginning. They actually grew our CBD business. And they'll say, I took P2 and now I don't have a period. I want to get married, or I'm married and I want to start a family. So we had what I call the P2 crowd. And then we had my age mates, the ones who are having fibroids and sort of like crazy menses. And then I was just really about pain. And if you look at my first video, I talked about a painless period, because that is what I experienced. Then with that, for you to advertise widely beyond talking to your friends, you have to actually go to the Ministry of Culture, because traditional medicine sits under Ministry of Culture, not Ministry of Health, even though we are petitioning it for it to be moved under health. And then you have to go, they will send you to University of Nairobi, Pharmacology and Pharmacognosy. And there they will take, your herbs or your whatever it is that you have, and they will run them through tests. And when they give you the report is sent back to the Ministry of Culture, where you get your certification. Once you have your certification, you can then do a video and put that video online. I talk about this video all the time. And the reason I made the video was I just was so tired of the questions. So I used to send it to friends. Yeah, okay, you try it. It does this. Now that video to date has 3.4 million views. And that is the video which blew up during COVID, actually. And then you have people from all over the country. So we have anecdotal evidence. We have the reports from University of Nairobi. We have 2 doctors, one in Uganda and one in South Africa at University of Cape Town. The one in Uganda is at Makerere, who want to now do clinical trials or clinical studies, and they have applied for funding to do that. So
in the
for us,
so
for us, really, it's been we've also like spoken to KEMRI, and we're working with all the different organizations that this body of work sits under to help us with the body of work, to help us with the research, to give us information. We have somebody who's on our team who's like who actually does research, and she's a biochemist, she's putting together the information. We have somebody else came today from the US actually who's taken some of the product and they want to go and do some research on it. So you on this platform in Nairobi, sort of like the studies that people are asking for, and I think people also don't underestimate the cost of doing these kind of studies and whether there are labs here who actually can do them.
Because I mean, you mentioned clinical trials coming in the future. You've been running this business for many, many years. You've been selling, as you said, thousands of bottles, but we don't know how they work. We don't know what the effect on the body is, and the question about the side effects. Because without clinical trials, you can't tell what exactly, which component works on which part of the body, which organ system, which hormone system, which enzyme system. So how, in the absence of clinical trials, can you assure us, or can you assure me to assure my patient that this thing is safe for them? The question about side effects and safety. How do we assure them? And safety as well.
The question about there is research available for each and every herb or tree in that, because they are being used, in pharmaceutical research. I'll use it as an example in pharmaceutical medicine, like Tendoit, our men's product. It has Prunus africana, which is what is being used to treat prostate cancer in the West for men above a certain age. So each individual tree, there's clinical trials or there's research that is available that we use to buttress what it is that we are saying, right? So there's that element. Then in terms of side effects, now what people are calling side effects are things like nausea, maybe vomiting, maybe urination, frequent urination, thirst is a big one. They sleep a lot the first week. So what people are calling side effects are what we're calling direct effects. It's the same way if you take a laxative and you will go to the toilet. So what I find in this market, people want to take a product and not feel anything at all. They don't want to feel thirsty. They don't want to change your sleep patterns. They literally want it to be working, but then for them, they're just comfortable. And I always say, well, these are not those kind of products. Even if you go to the village and you tell them, tumbo inauma, and they give you something, sometimes they give you something that you vomit for like 4 days. And I always say, this particular field is not for people who are very keen to see an allopathic outcome, to see things work the way they work with their own doctors, right? This is an evolving field. We are doing what we can with the resources that we have. We are speaking to the relevant bodies, but we're just not at that stage as a company that we can promise you that you're going to feel this, or you will not feel that, or you will not feel XYZ. Now, as I said, it's anecdotal evidence that is actually driving the company, and the sales are driven by the clients who keep coming back. We're seeing something like 5,000 to 6,000 bottles sold or products sold every single month. And this has been going on for years. So we always say that if you are the type who doesn't believe in anything natural at all, or if you want this sophisticated process, we advise you to go to the doctors. We also we tell people, go see your gynecologist. There are people who say, I don't want to see my doctor. I am not happy about XYZ. And I say, no, well, you have to take responsibility for what is happening with your body. Go see your gyna. What has your gyna said? Has he said you do surgery? What else has he given you? Okay, are you happy with your letrozole or your metformin or your Luprodex or your Zoladex? Are you happy with what's happening? Because we are just like natural wellness practitioners.
Yeah, so about, again, with the disease processes, so let's pick infertility, for example. Before we say somebody is infertile or subfertile, then there's certain criteria that they have to meet. So, like they've been trying for a year, unprotected intercourse, same partner, regular periods, that kind of thing. And then if after a year and a half, they have not conceived, they'll come. And then we know for you to conceive, the sperm count has to be okay, your tubes have to be open, ovaries are producing hormones well, your womb is receptive to a conceptus or an embryo. So we can investigate for those. So if a patient, if a client comes through Harriet Botanicals' door and says, I have irregular periods, but we don't know what is the underlying cause of our irregular periods, how can you start them? How can you start them on something? Tell them take 3 bottles or 4 bottles of this, but we don't know. It could be cancer of the cervix. That's why she's having bleeding, irregular bleeding. It could be cancer of the uterus. So how do you guard against that?
So we don't start them on anything. We ask them, there's a number of questions we ask them. Your age, your weight, the symptoms that you are speaking about, your gynecologist diagnosis, a hormonal profile test, an AMH test, even a sperm test. So we ask for all these things. We say, do you have an ultrasound? Do you have an MRI report? Do you have a CT scan? What has your doctor said? And then we tell them, you haven't been to a doctor? Please go back to the doctor and explain your symptoms, and he will tell you what to do. So what I have noticed is we have a lot of people who feel as if we are the last point of call, because there are many who have done 5 rounds of IVF. They're on so many facilities. They've done surgery. We have a lot of people who've done fibroid surgery twice or thrice. So they're not coming to us because they have a preference. They're coming to us because they feel they did not get the solution they wanted from the allopathic practitioners. But we don't prescribe without us asking for those gynecology reports.
Yeah. So it's reassuring that, the reassurance I can give my patients is that Harriet won't start you on anything until you've seen a doctor. Is that right? So nobody gets it over the counter?
Well, nobody once they've brought all those, and by that time they're even telling their doctor what they're taking. And there are so many that we turn away who, resolutely do not want an ultrasound, do not want to see a doctor. And remember that this is also sold in Healthy You. So if you walk into Healthy You and say, this is what I want, the same way you say, I want magnesium or I want zinc. And there they won't say to you, have you seen a doctor to measure your magnesium or your zinc levels? Right? So we, with third parties, we actually can't control the conversations happening. But our protocols, that's why we have like a huge training manual. I mean, I'm holding it right now as you speak. We have like training manuals, we have team leaders, we have a whole set of things happening at shop level, to mitigate against these things. And literally every day, every minute, we're sending people away. Please go talk to your doctor.
Yeah. Because, you mentioned the third parties that sell your products, like the Healthy Use, for example, and you mentioned that you don't have control over that. I feel like that would be a gap in your process, because, for example, if you franchise Java, for example, every Java you go or every McDonald's you go to should have the same quality of food, should have the same quality of service, should have the same products, the traceability of the products and all that stuff. So if you put your products on Nakumat, for example, and someone gets it over the counter, has a really bad side effect, kidney failure, liver failure, whatever it is, because they hadn't been assessed before they started your product, then how do you protect yourself against that?
So the agreements we have with third parties, for instance, is that there's a certain level of training that their employees must go through. And there's a certain level of information that they must have, and they must ask all these questions. It's like a cheat sheet. These are the 10 questions we expect you to ask. And there are people who have cancer, for instance. We have people with breast cancer who will come and say, I've been juicing, and I've been doing 1, 2, 3. They suggested I go for chemo, and I said no. They told me we're going to do 1, 2, 3. I said no. I'm just juicing. I feel better. I want arrowroot. You know, we have those, and we have those who come and say, I'm feeling so weak and tired, lakini sina pesa, mi siendi kwa daktari nipatie dawa. So there's all sorts of variations and all sorts of things happening. And all we can say is no, and whatever you think is going to happen with what it is we're giving you is probably not going to. And we can only advise based on that. And the same with any third parties we can train. Our service level agreements talks about all this. We have first level complaints, second level complaints, and then we keep all the communication channels open. So we have a CRM, we have social media. We are always on, whether it's on Instagram, on TikTok, or on Facebook. We're constantly talking to customers. We close late. Some of our shops close at 10, and there's someone actually online to speak to you if something has gone wrong. And we also have in our CRM, as an example, when you walk into the shop, all the details are recorded in terms of what you're treating, your ultrasound reports, and the fact that, let's say you've taken an arrowroot. When you next come in, the sales representative will open the CRM and find your details, and she can say, this person has taken 3 bottles and they were complaining about fibroids, and the fibroids have shrunk, and they've gone back to their gyna and they're happy. We have that data, and we are data managers legally, and with all the whole data protection. So for us, we're working with that level.
It'd be nice for the public to see. I mean, you say you have the data. So like this person had an 8-centimeter fibroid, for example. Yeah. If they go to a gynecologist, we'll say there's medication to manage your symptoms of pain and bleeding. However, there's no medication that will shrink your fibroid from 8 centimeters to disappeared. Like scientifically, yeah. So we'd say an 8-centimeter fibroid, you need to have surgery to have it removed. That's the treatment for a big fibroid.
Yes.
So have you published any of your data to say, this patient had an 8-centimeter fibroid, here is a scan, they took 3 bottles of arrowroot, now the fibroid is 2 centimeters, and here is a scan. Like the before and after, cause and effect of thing?
We have the before and after, but we've not published it. If you mean, we've worked with one doctor.
Is it available locally? Yeah.
The information? Yes, we have the information. We have the information on clients who come with I did an ultrasound in March, and now it is November. We have those who say, I had blocked tubes, here is the results, I am pregnant, We have those, we have that data. That is how so that when a client is walking into the shop, it's not the first time that you're seeing them.
Yeah.
You're not like, oh, really? You're more like, oh, okay, you've been trying for 6 months, and then you also did a sperm test, and then you've been seeing this doctor, and you were in Aga Khan, and then you went to, Moy referral. So we do have that data, and we do have doctors who, there are doctors who prescribe in the same way, whether it's from Moy referral, I think Nakuru referral. We have doctors prescribing from Kenyatta Hospital. We have others from Nairobi Hospital, and they have their notes. And one doctor actually gave us his notes of 30 patients, where we now followed and tracked, what has been happening from point A to point B to point C. And of course, there are those who come and say, well, it didn't work for me. Remember that we have never really claimed to be 100% a be-all and end-all cure for all things reproductive health for women or for men. We just say we alleviate. If you have pain, we can definitely help. If you feel you're over-bleeding, we can help. I mean, we're supplementary. We're supplementary and complementary to the allopathic practitioners.
Okay.
And this is something that we emphasize with our clients all the time, and a lot of them still believe that no, these ones are separate. They've got nothing to do with doctors. But we're talking about doctors all the time. If you come to my YouTube page, you will see that we've been talking to doctors. We've spoken to a functional practitioner. We've spoken to pharmacists. There's actually a group of pharmacists who use our products, who talk about it. So we are reaching out to other people to support us in what it is that we are doing. And it is like, very new, very novel in that sense.
Okay. I'll try and just go through a few more questions. Maybe we can just answer them a bit quicker so we get to a bit of them. So there's a question about, there's someone taking Obwaka Forte. So Obwaka Forte is for people with PCOS. So it has myo-inositol, it has folic acid, B12, antioxidants, all that stuff.
Yes.
Then they're asking, can I still have this product? So maybe to combine with other questions is, if you're on Arrowroot or any of the other herbal preparations, what can't you take? So like family planning stuff, antibiotics, other painkillers, like what is not compatible between herbal products and allopathic medicines?
So for ours, I can't speak for all herbal products. I can only speak for Arrowroot.
Yes.
And Arrowroot is not compatible with definitely family planning. It will override your family planning. It will do the opposite of what the family planning has done.
Okay.
It is only compatible with non-hormonal family planning and with a condom. If you don't want to get pregnant, really, you should rethink being on that product. Then it's also, when we worked with the doctor at Nairobi Hospital, what he said is that he recommends it to go with letrozole, but not metformin. And then I also know it's not compatible.
What was that based on?
Obwaka.
I mean, because you see, like when he says, you said there's a doctor who told you that you can use it with one and not the other. Yes. So when we speak about like levels of evidence, when a specialist says something, that's like the lowest level of evidence. You know, that thing of because I said so, because I've been doing this for many years.
Yeah.
I saw the paper you're speaking about, the doctor who gave you like 30 outcomes. Yeah. How can you advise people based on the word of one doctor who has not done any research on the product, who's not a specialist here? So, I mean, you mentioned the letrozole.
Yeah, for me, what I don't. I just tell you that you have to take responsibility for what it is, which protocol you want to observe. Yeah. If you're working with your doctor and he's put you on a lot of hormonal medication, not the supplements like Overcare or Pregnacare, if he has, you know, then think about the fact that when you take hours, you might be overloading. So maybe finish what you're doing with the allopathic practitioner, and if you're not happy with the results, and then maybe come back to us. That's our advice at that level, right? But I've seen people go to different doctors and they're all being told different things. Also, the doctors are not speaking with one voice. Some are saying you can do it like this. Some are saying you can do it like that. Some are saying you can use ashwagandha, you know, which is a herb just like us. Or some are saying you can use maca. Others, there's all kinds of information out there. I don't think we have a very solid body of work here for local practitioners, whether it's herbal or alternative or allopathic.
Yeah, I think for allopathic, we have international guidelines. So we have international bodies that give us protocols on what to do for each and every particular condition. So we have, they're called algorithms. So if a patient comes with a cyst, then what type of cyst is it? How big is it? Is it on one side, both sides? Do these blood tests. Are these ones high? This could be cancer. This could be a normal cyst. This could be hormonal, that kind of stuff. So for herbal practitioners, do you have international guidance on use of herbal products that guide your practice?
Yes, well, for us, the people we are speaking to, this practice is more developed in the West, because the West has a big sort of natural practice, whether it's you know, in whatever form it is, whether it's in the essential oil practice or all the different modalities that are there. So the people we speak to are, you know, naturalists or naturopaths or universities that actually work with naturopaths, which we don't even have a single university here that offers naturopathy, as far as I know. So it's still a very sort of like young market here. Now, the ones we are speaking to are happy to do the research, and they will provide us the research, whether it's on drug interaction or the side effects, so to speak. So that's where we are at. And that's why we tell people this very openly, that, you know, we're not as advanced as you'd like us to be or you'd hope for us to be. So maybe it's better if you have doubts, we may not be the people you want to be speaking to, maybe at the third or 10th point of call. And then in the villages, remember that 80% of people in the village are actually reliant on traditional medicine. And there's so many, for instance, there are women who would rather have a traditional birth attendant than go into a hospital. and we have the traditional midwives. Now, those ones do not believe in allopathic medicine. Remember, there's the whole group of people who say, you'll do whatever to me, but I will never go to a hospital. You know, there are cultures like that. So those ones are buying our products, and even an ultrasound, it is difficult for them to go. They will say, I don't believe in it. Just give me something natural, restore my body to balance. I just want to be well. The way wild animals out there, lions and giraffes, they don't go for surgery. How come they're not experiencing all these things? Just return me back to balance. So we have those as well.
Okay, fine. There's lots of questions on blocked tubes. You mentioned earlier about the medication being able to soften adhesions and unblock tubes, so to speak. So from an allopathic point of view, then we know you're likely to have blocked tubes, for example, if you've had previous infection. So you've had PID, like pelvic infection. If you've had a previous surgery, like multiple CSs. If you've had previous ectopic pregnancy. If you're on some hormonal birth control medication that can increase your risk. So we know the cause, the potential causes of blocked tubes, and thus we can advise. So if you have an infection, we can treat the infection with antibiotics. If you've had surgery before and your tube is damaged, then you can have surgery called tuboplasty to open up your tubes. So, you know, coming from my side is I can investigate the causes and I can treat whatever I find. So how can I advise my patients who come and say, I have blocked tubes, can I take Arorwet? So from now, the herbal point of view.
Okay, what I would expect is, first of all, what we are hoping the doctors can tell us is the cause of the blocked tubes, because the cause alone, first of all, will tell us sort of the length of treatment and whether we can do anything at all, you know, because if you have very tough adhesions, we may not be able to do anything. I mean, this is just like a way for the body to sort of create an environment where you can soften the adhesions and then they can pass out in a natural form. So, you know, again, we're working with allopathic practitioners, you know, to guide us. And there are many who come and say, well, I took it anyway and I'm pregnant. Or I had both were blocked, both tubes were blocked and now one is open. Or they'll tell you the kind of tubal blockage they have. We also ask, there's some type of tubal blockage which is very difficult to treat. And then there are those who've gone for surgery and they say, well, the surgery didn't work, right? I'm back again. They still say my tubes are blocked and I can't get pregnant. So remember the conversations we're having, you know, with women who are really looking forward to being mothers, and sort of all the different places that they've gone and not gotten what they want. And knowing women, they will keep looking, even if it's, you know, the other day there was a craze about okra. Even if it's okra and they say okra is doing something, they will take that okra and then wait and see.
Yeah. Do you think there's a psychological aspect to herbal medication as well? Like, as you mentioned, okra. So okra is been touted to improve with libido and lubrication. And we know a lot of that is psychological. Sex is psychological largely. So if someone is taking okra water, for example, and they're convinced themselves that their lubrication will be improved, then they will be improved because they're more relaxed. They know things are going to go okay. But it's not that there's no scientific evidence that okra water directly improves lubrication. Just because it's a mucousy kind of preparation doesn't mean that it goes into your stomach and then that magically goes into your vagina, if that makes any sense.
Yes.
So do you think with herbal medication there's a component of psychological
impact? Yes. First, I think what people get from a company like Harriet's Botanicals is sisterhood and a place that they feel is looking after them just for that. So remember, when women go to a hospital, first of all, they're seeing a lot of things that are kind of difficult for them to process. They're seeing death, they're seeing cancer, and there's a lot of practitioners, but none of them are specifically just tailored to them. So for me, what I always feel is when people come to Harriet's Botanicals, they feel like they're in a family. We all have the same problems. We all have painful periods, or we all have either fibroids, or you have PCOS, I have endo, you have this. So it creates some type of bonding with our clients. Number two, because we provide a lot of information, including lives like this, or information about because they'll come and say, Daktari amenipatia, what is it? Even if it's overcare, something as simple as that. Nichukue, what is it? So I feel as if we're very strong on the knowledge management side. Then that creates that placebo effect. I'm relaxed. I'm with other people who have suffered. I'm not the only one suffering. And then we're 80% women at staff level. So women talking to women. So I do feel definitely if you're relaxed, if you're happy, if you feel like you're looked after, the chances of you getting pregnant or having better sex are improved. So we cannot understate the placebo effect.
Okay. So there's two related questions. One is, can I take it during pregnancy? The other one, if I take Arorwet to reduce the fibroid, will I miscarry in the first trimester? So what's your, has any research been done in pregnancy?
Yes, so there are women who have large fibroids who, when they get pregnant, they continue with their Arorwet. And this actually was also a practice that came out of the doctor, again at Nairobi Hospital, who said to me, why do you tell clients to stop the product? I mean, it doesn't do any harm. And
how
so
does he know that? You know why I'm asking the tough questions? Because I know him. So I'm speaking from maybe I'm a bit biased.
So
because I can't tell somebody take this product in pregnancy in good faith without knowing whether it's safe in pregnancy. That was what I was driving at.
Okay, so what I can tell you is that it hasn't caused any harm for those who are taking it. They're taking it to people who have fibroids and they think they're going to miscarry because of the fibroids. So for them, they're like, if I manage to get pregnant, but I might lose this pregnancy. These fibroids are also growing, with the estrogen and everything else. So they're kind of caught between a rock and a hard place. So these are like, decisions that we leave with the client, whatever it is, whatever protocols they choose to follow. But literally once they conceive, we hand them over back to people like you.
Okay. So if I'm a patient, I come to you and I say, I'm pregnant, I have these big fibroids, I'm worried I'll miscarry. Can I take Arorwet in pregnancy? What would you tell them?
I tell them, no, how did you get pregnant? Have you been on our product? I mean, if this is typically a patient who's been with us, let's say, she's been with us for 2 years and she's had the fibroids and she was not getting pregnant and she did all kinds of tests and now she's pregnant. That's now what we consider our patient, not someone who came, who's been doing other things and then now they want to start using our products post. Because conception is sort of like where we end, especially if you carry to term. Again, that's a bonus. So at conception, we say consult your gynecologist, whether it's for folic acid, whether it's for other vitamins, whether the doctor tells you be on bed rest, whatever it is he tells you, that's really now you and your allopathic practitioner, because that is not our specialization.
Okay, fine. So you haven't answered my question. What do I tell my patients about Arorwet in pregnancy? Do we know it's safe in pregnancy? Just like a simple answer. Do we know it's safe?
It is safe. It is safe.
Okay.
But what you have asked me is to now provide, based on anecdotal evidence again, based on people using it.
So,
yes. You can say based on anecdotal evidence.
Yeah. As I said, like it's the lowest form of evidence. Like
that is fine.
It wouldn't stand the test of, if I give it and something happens, I won't have a foot to stand on in court, for example. You know what I mean? Like I can't go to court and say anecdotal. Yeah.
And that is why I say it is discretionary. It is discretionary. Yes. We don't prescribe past a certain point. We don't, we don't have herbs for pregnancy. We don't have, people ask me for medication to help with vomiting, for medication to help with, like high blood pressure during pregnancy. And I say, I actually don't. I don't have those. Yeah. I just have this product that really was supposed to treat painful periods and all those related symptoms. And how it has evolved is now continuing research, and we don't make any claims. So for instance, on the bottle, you're not going to find here says alleviates conditions related to pregnancy. You see what I mean? And this is something that we keep emphasizing. But if there are people who now choose to use it a different way, it's just like when you take a Panadol and they tell you take 2 for 3 times, and then you're in so much pain you take 4. You take one every hour. In a sense, you have been advised, you know. Yes. And we do put the disclaimers. We have other disclaimers. Another one where it says, if symptoms persist, please seek medical attention. We have another one, may interact with other medication when taken concurrently. So these are things that we put on the bottle. And there are many who will see what's on the bottle, ignore it, or ask to do something else.
Okay. And earlier you had mentioned that, I mean, you're registered with Ministry of Culture, and you said you're not registered with Ministry of Health, but something you guys are working towards, like to move to Ministry of Health. So that brings the question of the regulatory bit of it. So I have lots of questions on, are they KEBS certified? Because like Kenya Bureau of Standards is supposed to certify all products that are going into a human's body. So
no, okay, so let me just correct you there.
Yeah.
Kenya Bureau of Standards certifies anything that is classed as food, right? So they do not do traditional medicine. Doesn't sit under KEBS. It doesn't sit under Pharmacy and Poisons Board. It sits under Ministry of Culture, and that is where they have kept it for now. Practitioners are asking to be included in any of those bodies, right? So as an example, Pharmacy and Poisons Board will certify you as a supplement, right? Not as a medicine. So they don't regulate as well. And we've spoken to all these bodies. So some of our other products, the ones that are actually food, we have a porridge, we do have the KEBS certification for those. So we have all the certification that is needed for this particular genre. But it's not, it's underdeveloped if you ask me. And this is why whenever we come across people who are in parliament, members of parliament, and some of them, their children use our products, that's actually how we meet them. We always say, can you please help us with the legislation? Develop this legislation further. Do anything. We are willing to support. We are willing to spend a bit of money. We are willing to sponsor. What can we do to move this conversation, you know, from where we are now, so that more people can benefit, so to speak.
Okay. So, I mean, to answer this, people would just tell them that it's not certified by KEBS. It's not regulated by the Pharmacy and Poisons Board. It's at the Ministry of Culture, not Ministry of Health. Although it's being used as a medical product. Okay. All right. Fine. Got it.
Well, it's a supplement.
So I think
as a supplement.
I mean, so you would use a supplement to treat infertility, PCOS, fibroids. That's treatment. That's medicine, yeah? I mean, you said it's herbal medicine.
Hold on. That's why we don't say treat. We say alleviates conditions related to PCOS, endometriosis, fibroids.
But if you have fibroids, and you take Harriet and your fibroids disappear, haven't you, by definition, treated the fibroids? Or if you're infertile and you conceive, haven't you, by definition, treated the infertility? It's treatment. It's not alleviation, it's treatment.
Well, for me, when I give you the product and you have fibroids, what I want to alleviate is your pain. Your pain, your bloating, you know, frequent urination because the fibroids are pressing against your bladder. I am treating everything around it. You know, with the hope that things will get better, with the hope that now that your lifestyle has changed, now that your nutrition is better, now that you understand estrogen, now that you're evacuating estrogen, now that you've taken out the estrogen loaders in your environment or in your food, then you will get a better outcome, right?
Yeah. Okay.
There's a whole range of things happening. You can still go for surgery and still come back to us and say, well, I want it because of pain. Yeah.
Okay. I think myself and probably all the doctors in Kenya really look forward to the clinical trials because a lot of our work is based on the outcome of randomized, controlled clinical trials done multi-center, that kind of thing. So if you have like this product X has been tested in 50 hospitals across the world, we know how it works, we know what the side effects are, we know the safety profile, all that stuff, then we are more willing to push the product or to trust the product, so to speak. So as I was saying, we're just really looking forward to the clinical trials. That would be wonderful for everybody, so that probably if that comes through, then it could be in pharmacies as well, could be sold in hospitals, and that would be great for you, of course. Yeah.
Yes, I mean, we're also looking, we are really looking forward to that as well. I mean, we think this is an opportunity for so many people, you know, and just to create, you know, value addition for other things in the country. You know, our botanicals are definitely underutilized and underused. So we are looking forward to that outcome as well.
Yeah. So, I mean, this was really good for me as well as a doctor, just to understand the product, understand the limitations of the product, understand the gray areas of the product as well, so I can advise my patients better. I'll finish maybe with good feedback as well. I know I've been grilling you, trying to understand myself, of course. Trying to understand it better so I can explain it better. But we have lots of good feedback. I'll read some of them. So somebody tried Arrowroot because of PCOS. They had very painful periods, stopped after 4 months. Someone is now super fertile. Somebody had the ghetto that was cramps and they got better. I tried 3 different herbal options, including Arrowroot for fibroids, really balanced my hormones, regular periods, menstrual cramps reduced. Somebody says, my doctor would never approve of any herbal drugs, Western medicine all the way. And that's why we do this kind of thing. So to try and, as I said, bridge the gap. Because we're all trying to make the patient better, to treat conditions, to alleviate conditions. So I think it's nice that we work together. What else is here? Been trying, somebody asks about the bottles. How many, so a bottle is like, it looks like a liter bottle?
Yes. A bottle is a
liter.
But we are introducing, so this bottle, that's a liter, should last you 21 days on the 45 ml dosage, right?
So
we're introducing smaller bottle. 45 ml, which is, we now give a cap, which is 3 tablespoons. So now we have a measuring cup to go with the bottles. Yeah.
And that's once a day for a bottle will take you 21 days.
Exactly 21 days, and there's a 7-day break, and then you start another bottle if you haven't.
Okay, so just like the pills, really, just like the hormonal pills or the hormonal patches, you take 21 days on and then 7 days off. That's okay, fine, that makes sense. And then how many bottles does somebody need to take before they see relief? Because I have questions as well. We couldn't go through everything. Some said, I took 4 bottles, nothing happened. I took 2 bottles, I got worse, you know, all that stuff. So is there like a, you know, like for paracetamol, we'll say, okay, no. For antibiotics like Zinat, we'll say take for 5 days or for 7 days, depending on the condition. So is there a dose and a duration of treatment?
Yes, I mean, we always say the minimum dose we think is 3 bottles over 3 months. And that's when you're treating something mild, just period pain, right? And then we have people with endometriosis, very serious pain. We say this, you need even 9 bottles. Like for endo, we give you this long term until we reduce your pain even 50%. For endometriosis, what we just want to do is reduce pain, make you comfortable, make your life a little bit more bearable. And we have people with just, let's say, UTI. We have people trying to get pregnant. They were on the P2. Within 1 bottle, they say, well, I'm pregnant. I don't need this anymore. But what we have decided as a team now is just to say there's a minimum of 3 months for mild conditions. And remember, we have the extreme end where we're saying as you're working with your allopathic practitioner, at the same time, you're taking this for this amount of time with guidance from your practitioner. The minute they say, stop doing this, you stop. If they say, we don't like this, that's it. Because I just believe like the medical practice is all about teamwork and support and collaboration.
Definitely. Yeah. And you said it alleviates the symptoms. So something like endometriosis, if you're managing the pain, you're managing the bladder symptoms, the bowel symptoms. So once you stop the medication, the bottle, the herbal preparation, will the symptoms come back? Or do you find, like in your experience with anecdotal evidence or your feedback from your clients, once you stop the medication, or is it that kind of thing where like once you start taking Arrowroot, if you stop, your symptoms come back, then you have to start like a lifelong customer kind of model?
No, it is. So the Arrowroot, because you see, we call it, we have a holistic approach because we also advise on diet. So we advise on a number of things. you know, whatever it is that's going on with you, we tell you to exercise, to eat better, to step up on your veggies, maybe to reduce your carbs, to look at insulin resistance, and maybe to lose weight if needed. For instance, a lot of PCOS patients have a problem with managing their weight. So we change a lot of protocols. We have nutritionists on the team. And the idea is that after like a certain amount of time, you're feeling so much better. Now, endo is a bit different because it can just come back quite violently. Endo is violent, like that pain can resurface, and because we haven't understood it that well, how it manifests and why some people have such severe period pain. And this is why we say you may be on the product long term. But to take a decision after 9 months, you can say, okay, I'm happy, I don't want it anymore, or I just want to continue for general wellness. You know, there are those who say, I love the effect so much, I'm going to keep taking it. My bowel movements, I feel so energetic, I sleep so well, I drink so much water, my skin is doing so well, my libido, it's just giving me that buzz, that extra buzz in life. So there are those who just, like myself, just take it for general wellness and maintenance. So there's a whole range of people who stop immediately, and some who continue for a while, and some who stop, even go back to allopathic and then come back again.
Okay, fine. I realize we have just been dealing with the questions that were sent previously, like before the live, but we have lots of questions on the chat as well. Maybe we just cover, I think we have 4 minutes, maybe like 3 of them. I don't know if, can you access the chat as well?
It's like it's gone up. No,
if you press the question mark on the bottom right of the screen, is there a question mark for you as well?
Yes. Okay, shall I click that?
Yeah, just click that, and because that ties in with what bad experiences have you had with your products? What have your patients fed back to you, or your clients fed back to you about like negative experiences with your product?
So I think some people have come back and said, like, the fibroids one was, you know, why we started even prescribing a higher dosage for the fibroids. Let me just put this back. Why we started was, some say, well, it doesn't work. I've taken it for 2 months. I've taken it for 3 months. It doesn't work. And that's why for fibroids, we have a protocol where we say, take triple dosage, you know, morning, lunch, and evening for 6 weeks. Visit your gyna, go and do an ultrasound. If nothing has changed, stop the product. That's our protocol.
It's not working.
Only
so it doesn't work for everybody.
Like it doesn't work, and not in the same way. And not in the same way.
Sure.
I mean, you have people who after 1 month they're pregnant, and we had testimonials coming in all the time, and we put them on our page, and people would say, I took a bottle, I didn't get pregnant. You know, I took a bottle,
of course,
and it didn't work. It didn't work on me. And then we have people who don't change their lifestyle at all. What they're looking for is a one-stop shop, like a miracle cure. They take it and they want to feel exactly like their friend felt it. And then they say, this thing is useless. It doesn't work. And this is when we introduced our CRM, you know, so we can then monitor what's really going on with the client. Were they consistent? Did they give any feedback at all? Because sometimes people say it doesn't work at all. Then we say, but did your bowel movement improve? Do you feel better? Are you sleeping better? Do you feel more energetic? Did you get anything at all out of this product? And most of the time they say, okay, yes, this happened and this happened, but I'm not pregnant. And then we say, you know, pregnancy is about so many things. You might have such low egg count or such poor egg quality that we can't do anything about it. Or it could even be something to do with your husband. It could be low sperm count or 0 sperm count. So that's why we have this whole kind of like a circular economy around the client, saying, have you looked at all these 10 things? And if your egg count is really low, you're at an advanced age, it's unlikely you will get pregnant. Then, of course, we have people who got pregnant, they have endometriosis, and they have a miscarriage. And maybe they've been trying for 5 years. And then we have to manage that as well. And so we tell clients, if you have endo and you get pregnant, the chances of miscarrying are very high. So you have to understand the risks and the emotional stress you could go through taking a product like this, which works in a specific way, but still doesn't give you the outcome that you'd like.
Yeah. So I think the last thing would just be on, if people want to get more information, or even people want to give feedback, positive and constructive. So like there's a question on, I got a blood clot from taking this thing, the worst experience. I reached out to the team and the feedback was so inconsiderate and disappointing.
Oh.
Somebody says, to be honest, I bought it from the shop at Sour Mall and no questions were asked. Granted, I could have asked as well, but I got no information about even the number of bottles I'm meant to take. So there's lots of these kind of things. People on your products, people who have used your products before, good and bad outcomes, whatever it is.
Yeah.
How can they feed that back to you? Because if somebody got a clot, that's a huge thing. You can die from a clot. Now, if somebody bought your product but were never asked even a single question, how do they feed back to you to improve as well?
So we are, okay, so the one for the blood clot, I'm not quite sure, because sometimes people will tell you, your product gave me this, but they also won't tell you what else they're on and what other conditions they have. Because the blood clot, I'm just hearing it from you for the first time. The one about not being given enough information at shop level, that we've definitely heard, and that is why we introduced all these new protocols. That's why we introduced a CRM. Even the CRM, we never had that before. This is like a software that documents all this. And some clients come in and now they're irritated and saying, you're taking too long, you're asking too many questions. I already know what I have. I already know what I want. I want arrowroot. Just give it to me and stop wasting my time. You're asking too many questions and you're invading my privacy. So you see, it's always a fine balance. But we're open on all our social media platforms. My number is actually publicly out there. I tell it to people. People have my number, 0701-421-409. You can message me, even like the work message. And even if it doesn't make me happy, I still have to go back to the team and say, oh, this is what clients are saying. You know?
That's why I said good feedback and constructive feedback.
And then I monitor all our social media platforms. If anybody puts a post anywhere about Harriet's Botanicals, more than likely I'm the first person to see it, even in the middle of the night.
Okay.
So I'm on Instagram. So if
so
you can come, and we always say, if it doesn't work for you, if it didn't work for you, call us so at least we understand what we think we didn't do well for you, or we at least understand what it is we were looking at, type of thing. We're very open to that kind of thing, and you can find us in all our locations, etc. etc.
Fantastic. I think off camera we had spoken about you know, as we are speaking about like trying to bridge or merge this kind of like skin the cat in different ways, but still skin the same cat, like between like you and me, for example. We had spoken about having a doctor or doctor sessions at some of your outlets. And I think that would be great for the patients because they can come with all their scans and all their tests and everything. And I can give my interpretation of it, and then you can give your advice as well. And I think if we do that, then the patient can have the best of both worlds, if that makes sense. Yeah.
Absolutely.
So I'm
happy
really looking forward to that. So let me know.
Just tell me the days that you're available to come and sit in any of our shops. I mean, in Nairobi, there are 4 of them. If you can come every Friday to a different one and spend, let's say, the morning there or a Saturday, whichever day, and we're very happy to partner on that. That would really give us a lot of comfort and also help our staff understand better the conditions that we're dealing with.
Fantastic. Harriet, thank you so much for your time. Thank you for your knowledge. Thank you for your advice. Thank you for being very knowledgeable about it. Thank you for being so very gracious, even in the face of pressing questions from me, but I have to do it. I think we've run over our time, but I'm sure the questions will keep flooding in. I'll keep sending them to you. I'll send you all the feedback I've gotten as well.
Thank you so
much. If anybody needs to contact you, they know they can reach you directly.
Absolutely. Thank you so much.
Thank you so much, Harriet. Have a lovely evening, and thank you everybody for attending. This was a good turnout today. And we look forward to interacting with you every Monday. All right.
Wonderful.